Okay. Ready to dive into something, maybe not a typical dinner table conversation.
Game? What we got?
Diarrhea.
Ah, always a crowd pleaser.
Right. But before anyone hits that skip button, we're actually going deep on this one. Specifically, how it's not just, an inconvenience, but a real concern in critical care.
No, that's interesting because, yeah, most people don't realize how dangerous it can be if someone's already critically ill.
We've got two journal articles here, both focused on diarrhea in ICU patients, especially those getting enteral nutrition.
And you're right to call it critical. We're not just talking discomfort, though that's obviously part of it, but a whole cascade of potential problems that can even be life-threatening.
So paint that picture for us. Someone's in the ICU, their body's already strained just to stay stable. How does diarrhea mess with that?
Think of it like, trying to fill a leaky bucket. That's kind of what happens with fluid loss, dehydration, and then you throw in electrolyte imbalances on top of it.
And those are already things they're carefully managing in the ICU.
Exactly. It's like pulling the rug out when they need all the support they can get.
And then, to make matters worse, our sources talk about how it impacts nutrient absorption, like trying to fuel a car with a hole in the tank.
Precisely.
Yeah.
Especially for patients on enteral nutrition, where the whole point is delivering those nutrients. Diarrhea really throws a wrench in things. And it doesn't even stop there.
Oh, there's more.
These articles really highlight the infection risk, which is huge in the ICU, where immune systems are already iffy.
Makes sense their defenses are down.
Right. So it's not just the diarrhea itself, but it can open the door to even more complications on top of what they're already dealing with.
Adding insult to injury, basically.
And here's where it gets even trickier. They also get into how diarrhea impacts medication effectiveness.
Oh, wow. I wouldn't have thought of that.
All about absorption, or lack thereof. If you have diarrhea, meds they might desperately need, blood pressure meds, even antibiotics, they might not work as well.
So it's a chain reaction. This seemingly simple thing can snowball. And it's not just physical, right?
Absolutely. Put yourself in their shoes.
Yeah.
Critically ill, hooked to machines, vulnerable, and now diarrhea on top of it. Emotionally, mentally, it takes a toll.
Right. It's easy to forget there's a person going through all that, not just a medical case.
Exactly. And that's why this stuff matters, even if you're not a doctor.
Yeah.
Knowing this, you can ask the right questions for yourself or a loved one, make sure it's taken seriously.
Knowledge is power, as they say. Speaking of, let's unpack what even causes diarrhea in the ICU. Doesn't sound like it's simple.
Yeah, our sources make it clear it's like medical detective work, right? You see diarrhea, but figuring out why is the tricky part.
It really is. Like untangling a big mess, multiple things could be going on. And our sources point to one culprit that's often missed: meds.
Medications? I mean, it makes sense. Every drug has side effects, but you don't always think about it.
Exactly. And in the ICU, they're on so many things. Those side effects add up. Our articles mention some surprising ones. Potassium supplements can do it, some blood pressure meds, even over-the-counter stuff with that sweetener, sorbitol. Sorbitol, yeah, I've seen that on labels, never really knew what it did.
Well, it's a sugar alcohol, and it can have a laxative effect, especially in larger doses, hiding in plain sight. But maybe the biggest medication-related one we got to talk about is antibiotics.
Right, the necessary evil. You need them to fight infection, but man, can they mess up your gut.
And that is key here. Antibiotics don't play favorites. They wipe out good bacteria along with the bad, totally disrupting that balance in the microbiome. And that creates a perfect environment for things like, C. difficile.
C. diff, yeah, that one always sounds scary.
It can be, especially in the ICU. C. difficile can cause some nasty inflammation in the colon, leading to, yep, you guessed it, C. difficile-associated diarrhea. And that kind can be brutal to treat, so it's a real concern for these patients.
So we've got meds as potential bad guys, but our sources bring up another plot twist: enteral nutrition itself. Seems counterintuitive. You're trying to feed them, and it causes this.
It's true, and it shows you just how complicated critical care nutrition is. Quick reminder for anyone who's lost enteral nutrition, or EN, is when you deliver nutrients directly to the digestive system, usually through a feeding tube.
Right, and that's often preferred over IV nutrition if possible, right?
Exactly. EN helps keep the gut working like it should, and it usually has fewer complications compared to IV feeding. But, and our sources are very clear on this, there's a real balancing act when it comes to EN and causing diarrhea.
So it's not just as simple as, oh, you're on EN, you might get diarrhea. There's more to it.
Way more. Even just the makeup of that EN solution matters. Like, if it's really concentrated, we call that hypertonic. It can pull water into the intestines and boom, diarrhea.
Like that osmosis experiment back in school with the potatoes.
Exactly. And then on top of that, you've got the fiber content, the type of fat, even the temperature. It all makes a difference.
So many things to juggle.
It's a real balancing act. And then you add on how fast you give it and how much. Too much too quickly overwhelms the gut. Like stuffing a suitcase, something's got to give.
Perfect analogy. So slow and steady wins the race, letting the gut adjust.
That's the idea. And our sources even point out that timing matters. Going too long without food before starting EN can make the gut sensitive, more likely to have diarrhea. And then on the flip side, being on it for too long can also increase the risk.
It's wild how much there is to consider for something that seems so simple, just getting nutrition into someone.
And we're not even done yet. Our sources also talk about the risk of the EN solution itself getting contaminated. That can introduce bad bacteria, and, well, you can guess what happens then, diarrhea.
So you've got meds, EN, contamination. It sounds like preventing this whole diarrhea thing in the ICU is a real challenge. What can be done? Our sources seem big on getting ahead of it, preventing rather than just reacting after the fact.
Makes sense, right? In critical care, they're already fighting so many battles, it's about shoring up the defenses before things go haywire.
Love that analogy. So what kind of proactive defenses are we talking about here?
Well, first up, that medication review is huge. Like we said, even harmless drugs can backfire. It's about weighing those risks carefully in this situation.
And that's where clear communication comes in, right? Between the doctors, the patient, the family, everyone's on the same page.
100%. Got to have that open dialogue. But meds are just one piece of the puzzle. Optimizing that enteral nutrition, that's another big one.
Right. We talked about starting slow, letting the gut adjust.
Exactly. Can't rush it. And then the actual EN formula itself, that matters too.
Makes sense, like those low FODM ones we mentioned.
Yep, got to tailor it to the individual.
Yeah.
And there's so much research happening on this. Like some studies suggest giving EN continuously, slow and steady, might be easier on the gut than on and off.
Interesting. So it's not just what you give, but how you give it.
All about those details. But beyond that, there's a whole other frontier in gut health that could really change the game for preventing this.
I was hoping we'd get to this. All this microbiome stuff, it's like we're just scratching the surface.
And it's a huge factor in how things play out in critical care. Our sources talk about some really cool research, probiotics, prebiotics, even this protein, lactoferrin.
Okay, quick recap for our listeners. Probiotics, that's the good bacteria we want in the gut, right?
You got it. Keeping that balance in check. And prebiotics, think of those like fertilizer, helping the good guys thrive.
So it's a two-pronged attack. And what about lactoferrin? I haven't heard that one before.
It's this powerful protein found in milk and stuff, and it's got some serious antimicrobial, anti-inflammatory properties, like a bodyguard for your gut, keeps those bad bacteria in check.
I like it. So between those three, it's like sending in reinforcements to help prevent the diarrhea in the first place.
Exactly. And the research is still early, but there's a lot of promise there.
Definitely exciting to keep an eye on, but realistically, even if you do everything right, sometimes it still happens. So then what? How do you actually treat diarrhea in the ICU?
It's like triage. Got to figure out what's causing it first. Is it the meds, the EN, an infection like C. diff? That dictates what you do.
Back to detective work.
Right. But while you're figuring that out, got to provide support. Rehydration's key, usually IV fluids, and keeping a close eye on those electrolytes.
Because those can go south fast, especially in the ICU.
No time to mess around.
Yeah.
Then, depending on the culprit, you might adjust meds, change the EN formula, even switch to IV nutrition for a bit to give the gut a break.
So multi-pronged attack, again, hit the symptom and the root cause.
Exactly. And one thing to remember, those antidiarrheal meds, they can give temporary relief, but they don't fix the underlying problem. Sometimes they even make it harder to figure out what's going on because they mask the symptoms.
So not just a matter of popping some over-the-counter stuff.
Nope. Got to be smart about it.
Well, we've certainly covered a lot of ground on this deep dive. The seriousness of diarrhea in the ICU, all the things that can cause it, and then how to prevent and treat it. It's a lot more complex than people realize.
It really is. And it just goes to show something that seems minor in everyday life can be a huge deal in this setting.
For sure. And knowledge is power, right?
Yeah.
For the medical team, for patients, for families, everyone.
Absolutely. The more we understand, the better equipped we are to advocate for the best possible care.
Couldn't agree more. That's all the time we have for today. For the deep dive, I'm host Name.
And I'm expert Nate.
Thanks for joining us.